Hello and welcome to a new video on our unitology series where we are explaining unitology in a very smart and easy way. Today's topic is microcephaly, which is by definition when the baby's head circumference is less than normal or when the baby's head is small. When head circumference measures more than 3 standard deviation below the mean for age and sex, then the baby has microcephaly. This condition is relatively common, especially in children with developmental delay. This is a normal baby head size and this is microcephaly. Routinely, the head circumference is measured after birth to evaluate the baby's condition. And this is a diagram of the normal head circumference of a neonate. Also, the average newborn's head circumference is 13 and 3/4 inches, which is equivalent to 35 centimeters. Generally, a newborn's head is about half the baby's body's length in centimeter plus 10 centimeter. So, if we divide the baby's body length by 2 and add 10 centimeter, this will give us the head circumference in centimeters roughly. So, this is a normal baby head size, this is microcephaly, and this is severe microcephaly. What is the pathophysiology of microcephaly in short? There is abnormality in neuronal migration during fetal development, including heteropias of neuronal cells and cytoarchitectural derangements. These changes contribute to the disorder called microcephaly. There are two main types of microcephaly, which are the primary type, which is called the genetic type, and secondary or non-genetic type. The primary type per se has no associated malformations, so it's called primary. It follows a Mendelian pattern and it may be associated with specific genetic syndromes, as we are going to discuss later on. As for the secondary or the non-genetic type, there are several subtypes of this type, which include four famous syndromes, which we are going to discuss later on, some congenital infections, and other causes. The primary type is usually present since birth, or is always present since birth, and there is a remarkable shape of the head where there is low crown, receding forehead, occipital flattening, and skin wrinkling. As for the secondary type, unlike the primary one, it may be present at birth or presents later on, and not all these special markings or foundings are found. So these findings here are not necessarily found in the secondary or the non-genetic type. The pathophysiology of the primary or genetic type of microcephaly include defective cellular migration, defective neurulation, and defective prosencephalization. Speaking about the primary or the genetic type of microcephaly, it includes some other subtypes which are autosomal dominant, familial or autosomal recessive type, and X-linked microcephaly. Speaking about the incidence, the familial or the autosomal recessive type is more common than the autosomal dominant, which is more common than the X-linked microcephaly. So the X-linked microcephaly is the least common among them. It's caused by gene mutations that lead to severe structural brain malformations such as lissencephaly, coplestone dysplasia, holoprosencephaly, where the forebrain of the embryo fails to develop into two hemispheres, polymicrogyria, neuronal heteropia. So, the examples of genetic microcephaly include familial or autorecessive type, autosomal dominant type, and the X-linked, which we discussed in brief, and some other syndromes we are going to discuss later on. Here's a little comparison between the autosomal recessive type and the autosomal dominant types of microcephaly. As we said before, those types follow a Mendelian pattern of heredity. So here the baby inherits abnormal genes from both parents since it's recessive. So it requires two genes to appear in the baby. The baby has a typical appearance of slanted forehead, prominent nose and ears. Also, there is severe mental retardation and prominent seizures. As for the autosomal dominant type, the baby inherits abnormal gene from one parent, as this condition needs only one dominant gene to be shown or to be present. There is non-distinctive facies unlike the autosomal recessive type. However, there may be upslanting palpebral fissures, mild forehead slanting, and prominent ears. The mental retardation is mild or borderline, and there is normal linear growth. The seizures are readily controlled. So, speaking about the incidence, as we said before, the autosomal recessive type is more common than the autosomal dominant, which is rare. As for the special neurological findings, here there is surface convolutional markings, poorly differentiated and disorganized cytoarchitecture. As for the autosomal dominant type, there is normal sonogram. However, the MRI is abnormal and shows the following findings: abnormal brain development, small cerebral and cerebellar hemispheres, and pachygyria. Here's a picture of the familial microcephaly, where the typical appearance is slanted forehead, prominent nose, and ears. As for the autosomal dominant microcephaly, here there is no distinctive facies as we can see. However, there is an upslanting palpebral fissure and mild forehead slanting. Here we come to the syndromes which are associated with the primary or genetic microcephaly, which are Down syndrome, Edwards syndrome, Cri-du-Chat syndrome, Cornelia-Dulong syndrome, Rubinstein-Taybi syndrome, and Smith-Lemli-Opitz syndrome. The three syndromes we are going to discuss here are Down syndrome, which is called trisomy 21, Edwards syndrome, which is called trisomy 18, and Cri-du-Chat or 5p minus. In the Down syndrome, there is abnormal rounding of the occipital and frontal lobes, as we can see, and also narrow superior temporal gyrus and small cerebellum. This person later on will show propensity for Alzheimer, neurofibrillary alterations, and ultrastructure abnormalities of the cerebral cortex. Here is a picture of an adult with Down syndrome or trisomy 21. As for Edwards syndrome, which is called trisomy 18, the baby will usually have low birth weight, prominent occiput, microstomia, micrognathia, low set malformed ears, flexion deformities of fingers, and rocker bottom feet. As for Cri-du-Chat or cat's cry syndrome, which is also known as 5p minus syndrome, which is a chromosomal condition that results when a piece of chromosome 5 is missing, the infants in this condition often have two special characters which are a special cry and a special facies. The special cry sounds like that of a cat, and that's why it's called Cri-du-Chat, which is cat's cry in English. So it's a French name that means in English cat's cry. As for the facies, there is round facies, prominent epicanthal folds, hypertelorism, and low set ears. So there's round face, prominent epicanthal folds, hypertelorism, and low set ears. So here are some other pictures of children with Cri-du-Chat syndrome, which is a very characteristic syndrome among the primary or the genetic types of microcephaly. Thank you for listening and wait for the part 2 of microcephaly video.